Hey, Adam,
Geez,
one
why,
thing.
why do you think they called bumpers, Gary?
I don't know.
Because they come at the beginning and at the end, like bumpers.
Alex, you're a marketing guy. Do you like that design behind Paul? Does that sweet logo thing look pretty cool to you?
Hey, I forgot to hit the record button.
Yeah, that's really professional, isn't it?
Well, this is a professional podcast.
I met her in a parking lot and was handed 2 little Yorkies. And the only person I knew that knew Yorkies was Paul. So I called Paul and said, Paul.
Sweet Talk is a weekly 20-minute podcast brought to you by the Continuing Education and Workforce Training Division of Idaho State University's College of Technology. Find us on Apple Podcast, Spotify, and SoundCloud and subscribe today. Now it's time to get started with Sweet Talk.
Hello, everyone. Welcome back to Sweet Talk, our weekly podcast here at Idaho State University's Continuing Education and Workforce Training. I'm Paul Dickey. I'm the apprenticeship coordinator here at Sweet, and joining me, as always, is Angie Wilhelm, our marketing director. Angie, how are you doing today?
I'm doing really well. I'm excited. I say that every single time I'm excited about this podcast.
Yes, you do. Every
But
single time.
for those of us who watch us regularly, if you do not watch us regularly, go back go back one section. We are welcoming back Wes Usyak. He is the program coordinator and the senior instructor, clinical instructor for the Pharm Tech program here at Idaho State University. If you watch us continuously, you will see that he was actually on one of our latest podcasts where we talked about students going through his program into the Pharm D. So I'm going to welcome Wes because he actually brought a student with him today to talk just about that. So we're really excited to have him back. Welcome back, Wes. How are you?
I am very good. Thanks, Angie, for the introduction, and Paul. I'm like she said, I'm Wesley Usyak. I'm the program director. I also brought with, like Angie said, a student with me, and actually she's more than just a student, a graduate. So I bring with me LynnDee Romrell or Romrell. Did I say it right, LynnDee?
Yep, Romrell.
Okay. Yep.
Romrell.
And so she turned around and she finished my program and then went off to be a pharmacy technician, and then wound up again being like a lead tech over at Bengal Pharmacy, and then took a step forward and now is in her 3rd year of pharmacy school and kind of again gone down that ladder. So LynnDee, floor is yours. Go ahead and introduce yourself.
My name
I
is
kind of
LynnDee
already gave you
Romrell.
that. Sorry. Yeah.
My name is LynnDee Romrell. I graduated from the Pharmacy Tech program in 2019, and I worked as a technician at Bengal Pharmacy for about 4 years, worked my way up to being a lead pharmacy tech. It was a fantastic experience, loved the environment that I was in, and working with the pharmacists that worked with ISU. And the students that would rotate through, the pharmacy students that would rotate through our pharmacy, inspired me to go back and get my Pharm D degree. And so now I'm in my 3rd year with 1 more year to go.
Excellent. So, LynnDee, first question, why pharmacy?
Why pharmacy? I've gotten that question a lot. By happenstance, I ended up moving to Pocatello, and before going to any school, I went to BYU, Idaho, and I was working on getting an agribusiness degree. So I'd work in agriculture because that was my background in high school. Once I moved down to Pocatello, we didn't have any agriculture degrees, but I'd always been interested in pharmacy. When I would go to Brolum's in Rigby, I just thought it was so cool. And then I would go to Idaho Drug with my grandma and help her get her prescriptions. And just the help and care that the pharmacy technicians and the pharmacists had really inspired me. And so when I saw that ISU had the Pharm Tech program, I decided, you know what, I'll give it a shot. And I am so glad I did. I absolutely love it.
Now,
so I have a question.
Go ahead,
which actually this whole podcast was inspired by what we'd asked Wes on the last one. What was it about going through your Pharm Tech to Pharm D, right? Like when you made that transition, what part of your Pharm Tech really led you into making the decision to do your Pharm D, or was because it seems like that wasn't your intent the entire time, that it was you got your Pharm Tech and then decided to go Pharm D?
I'll be honest, I was young when I first started the pharmacy tech program. I, like many students, didn't know for sure what I wanted to do.
Mhm.
And so the Pharm Tech program was a stepping stone, and being able to work at Bengal Pharmacy with several of the clinical instructors that would teach for the pharmacy program, they inspired me. Like, for example, Dr. Anushka Birdie, she worked there and she would primarily work in the HIV clinic at Health West. And I was in charge of helping those patients and getting their medications ready. And just the amount of care that she had and influence that she had on these patients really inspired me.
So, when you started the program, you said you were you were fairly young, and you
Mhm.
picked this because initially the agricultural program wasn't available, and you just go,
Yep.
"Hey, this is what I want to do." Now, if I remember, Wes, you described that you have to work in a pharmacy as part of your program. Is that correct?
Wouldn't say it's necessarily work. They do like a 180-hour externship during their spring semester.
Right,
So, like,
right.
if that turns into a job afterwards, that's great. Doesn't
Uh-huh.
necessarily have to be. Again, that can actually be like an extern or like an externship too, where it's non-paid like clinical hours.
Okay. So you went, when you did the Pharm Tech program, you actually went from the classroom environment to an actual work, doing the job. How was that transition? I mean, you're now working with the public, and you're on a daily basis, you're being tested on what you've been learning in class.
Yeah, it was a shock at first, but I feel like Wesley really set us up for success by trying to make the learning environment as similar as possible to what you would actually experience in an actual pharmacy. My biggest thing was I worked in where I did my practicum hours at Bengal Pharmacy and their telepharmacy. One of the things is with telepharmacy, all of their phone calls would come into the main central pharmacy where I was at. And so I was overwhelmed with the amount of phone calls that we were getting, which now I don't even bat an eye at it. I'll answer the phone, I'll help whoever. But that, and I would say working with insurance, because there are so many different insurance plans out there that it's hard to teach in a classroom. And so it's really learning on the job. So I'd say one, the phone calls, which I know that Wesley has implemented into the program, where you're working with all of that chaos, the ringing, the noise, the sounds, because that's what retail pharmacy is. And I'm not sure, Wesley, have you incorporated anything more with insurance? I know it's a really hard task to do when there's so many different plans and problems out there.
We've struggled, and I'll say that, but struggled with again finding like different software systems that'll allow us to actually again do different things with insurances. So we do like you, as you remember, I'm sure you went through or remember like the NRX training and going through that,
Yeah.
where it kind of walks you through again insurance cards, and there's a few labs that do that. That's about as much as I've done. I really lead that up to again the sites, because again it's kind of like that on the job where you're actually get to see it. And I think that's what makes the program unique. I'm not making excuses of, hey, again, it'd be a nice piece of thing to or be a nice tool to have, but that's like something where you go out on those clinicals and actually see it like live and see
Mhm.
again, it's like LynnDee said, it's not just one insurance, there's like 20 different insurances. And then you could put the caveat that Bengal Pharmacy is going to do different inputting of that insurance than Fred Meyer, and Fred Meyer is going to do it different than Walgreens. And it's not like the same to where it kind of makes it again difficult. Um, I appreciate again what she took from the classroom and was able to bring it alive, because some students can't do that. She was one that was always able to do that. And I think that's helped her again be successful in where she's at. I'll tell you, and I'm not here to embarrass you, but I'm gonna just say like there were times I remember her saying, I don't know if this is for me or that, especially during that first semester. And then when she went into her second semester, she shined, and again, three of many years later now, she's sitting almost done with pharmacy school. She's got one,
Wow.
2 years left, and that's it. Right, right. You have the third year and fourth year, and that's it, right?
Yeah, yeah.
Yeah.
I'm like,
I can't even believe it, but that's
So
awesome, and she'll be basically as I told her actually, and I'm going to make a joke of it. I told her a couple of days ago when we were talking back and forth about this, I'm training her so she could take over for me.
excellent, excellent.
Well,
Exactly,
the thing I like about these stepping stone or these pathway jobs is that, you didn't know what you wanted to do. You took this 1-year program, and in a couple of years, you're going to have a doctorate. You're going to be a doctor of pharmacy, right? Like, did you ever in a million years think that when you moved to Pocatello that you'd have a doctor of pharmacy?
No, I never thought in my life because I'm a first generation college student. My parents, like my dad, he did take a few classes, but I don't know if he ever got a degree. And so going from small town Rigby, Idaho,
Mhm.
with family not really in academics at all, to going all the way up to a Pharm D, I like, if you would have asked me, like, I've been out of high school for 10 years this year. If you would have asked me 10 years ago if I would be a doctor of pharmacy in 2 years, I'd say, what are you talking about? No.
Mhm.
So obviously you're working in the program, you're in class. What do you find is one of the biggest struggles of doing this?
It's the biggest struggles of a doctor of pharmacy.
Yes.
The amount of information that we have to learn in such a short amount of time, because you think, yeah, I need to know these drugs and like the name brand, the generic name. Yes, you can learn that. However, you need to learn all of the side effects, all of the interactions, what might happen if they're combined, how it's going to act on the body. It's just there's so many different things. And one thing that I really love about the program that I'm in right now is they're also teaching us the pathophysiology behind the diseases that we're treating with these medications. And so we're getting a full span of knowledge. And that's honestly the most difficult thing, is trying to make sure that you remember every single detail so that you can take the Naplex and apply it to your future career.
Mhm.
So a big, large scale question I have, LynnDee, is you're Pharm Tech, you're going into the Pharm D program. In a typical pharmacy, how are those divisions of labors done? What does a Pharm D do, and what does a Pharm Tech do at a pharmacy? I'm sure there's various things, but what ballpark? What's the difference?
So I'm just going to state first off, a pharmacist is nothing without their technicians. So the technicians are the ones that are running around the pharmacy, getting the prescriptions filled, which I won't say that that's just a technician's role. I think it's a pharmacist's responsibility as well. But on a typical, like what you'd see in difference is your technicians are going to be filling the prescriptions. They're going to be answering the phones, pharmacists do as well, inputting prescriptions, ringing patients out. But when it comes to the pharmacists, they're the ones that are doing the clinical decision making. So you get a new prescription for somebody who is on, let's just say, amoxicillin. Well, great, amoxicillin, antibiotic, it's what we need. However, the pharmacist is going to look at patients' past fill history, look at their allergies, see if there is an allergic reaction to penicillins or amoxicillin. They're really the safety net for prescriptions that are coming in and making the clinical judgment of, is this safe? Is this appropriate? Is it for the right indication?
Okay, so from what you're saying, you must also deal with the doctors directly as well, because I'm sure if you come across an issue, you must have follow-up questions, and then now you have to deal with the doctors who are prescribing this.
Yes. And a lot of the time, the Board of Pharmacy law book has become really simplified because they want the pharmacist to use their clinical judgment. So if a prescriber sends in a prescription that, oh, they sent it in for capsules, but really there's only tablets available, we as pharmacists, we're expected to use our clinical judgment. Why would you call a prescriber and ask them, oh, this only comes in tablets? You would just automatically switch it over. But yeah, you will speak with providers saying, hey, I don't quite think this therapy is appropriate. Can we switch it to something else? Or this patient has an allergy. What do you want to do next? Stuff like that.
Okay, excellent, excellent. Have you working towards your degree, have you started doing that already a little bit as you're working towards your degree at your workplace?
I personally have not because I work inpatient in the hospital. And so I'm
Oh,
spending a
okay.
lot of time in the IV compounding room. But there are things that'll come through where I'm like, is this right? Can we switch this? And then the pharmacist will call and make that decision with either the nurse or the provider. So it's a little bit of a different role when you're inpatient than versus outpatient retail.
Right. So,
So
if I'm sorry, Angie, you go right ahead.
go. You're already in. I'll go right
Okay.
after you, Paul.
So, am I correct that you guys have to do an internship as part of the Pharm D program as well?
Yeah, so we have rotations that we have to do. So for my first year, I went to a retail pharmacy up in Idaho Falls and did 120 hours. So I got that experience. I was mostly working on management type activities as well as more clinical, just because I knew my preceptor. And so he wanted to put me in a more clinical role because I had actually worked there previously. And then after my second year, which I actually just completed, I went to Portneuf and was able to work inpatient. And I rotated through the ICU, the NICU, so neonatal ICU, peds, medical surgical, and the emergency department. And so you get your 120 hours your first year, 120 hours your second year. And then after this year, I'm going to have clinical rotations for basically a whole year of where I'm going to different practice sites for 6 weeks at a time.
Excellent.
So my question is, you went Pharm Tech, worked in a pharmacy, and now you are in a Pharm D doing rotations. How has the Pharm Tech program and your experience after the Pharm Tech program helped you in the roles you're in now?
Oh, it's been an exceptional help. I actually still use a lot of the resources that Wesley had. Like we had assignments where, okay, we're going to make the top 200 flashcards. I still use those because the drugs really haven't changed. Yes, we're adding on more, but I'll still use those for, okay, what's the mechanism of action? What are the side effects? What's the brand generic? And then he also had us make a huge, like, kind of spreadsheet of all these different factors that I'll still refer to. And it's just been a lot easier because when we're talking about these medications in class, it's not the first time that I've come across them. So it makes it easier to learn the pathophysiology or different mechanisms. Just because I've already covered that, it's been beneficial. And especially with where I work in the IV compounding room, we had a whole unit dedicated in the program to working with sterile compounding. And honestly, I didn't like it when I was in the program, was not my favorite. I didn't like needles, but now it's my absolute favorite thing that I do at work. I've actually requested, hey, can I primarily do this because it's my favorite thing to do.
Okay. So, I guess what you're saying is doing the Pharm Tech and then using that as the step into the Pharm D program was very beneficial for you.
Oh, 1,000%. I would recommend it to anybody who's considering going into pharmacy school. Get that Pharm Tech license, go through the pharmacy tech program first, get that basis of knowledge because it will help you an amazing amount when you actually get into the program.
Excellent, excellent. So I've got to ask the standard question. What's the most rewarding part of being a pharmacist?
Most rewarding part, I think just being able to know that you are saving lives and helping people. I had an opportunity to sit in the emergency department over my rotation last week, and we had tons of strokes come in. We had motor vehicle accidents, stuff like that. And I was in there with the pharmacist getting medications ready for people who were intubated or ready to be intubated.
Wow.
And so it's just knowing I am delivering these life-saving medications. And hopefully in the end, that person is going to recover. And so I think honestly, why I do pharmacy in general is just to help people and see that difference. Because I've had people, even from when I worked as a pharmacy tech in retail, they'll run into me at the grocery store and they're like, hey, I know you. And I'm like, yeah, I'm the one that helped you with your insulin, helped you find a coupon so you could afford it. And so it's just like, okay, I am making a major impact on people's lives.
That's
Well,
amazing.
We actually only have 1 minute left, surprisingly.
Oh.
So I'm going to turn over to Paul to kind of wrap us up.
Well, I actually, I want to start off by saying, LynnDee, thank you so much for being on the show today. Really appreciate you sharing your experiences with us. Wes, thank you for introducing us to LynnDee. But Wes, if you'd like to give some information, if someone's interested in the pharmacy tech program, how would they make that first step?
Best thing to do is to contact the College of Technology and talk to one of our, again, student success navigators or our recruiting team to come and take a tour of ISU so they can contact us. They go to isu.edu and then again, just click on tech. Again, they can see all the College of Technology programs or give us a call at 208-282-2800 and set up, again, a time to either meet with us or talk to an advisor about all of our programs.
Excellent. Excellent. Thank you so much, Wesley.
Yeah, thank you.
I really appreciate you both being on the show today. Angie, always a pleasure to have you with me.
And I just like to say that, LynnDee, I bet your family is so exceptionally proud of you.
Yep, they tell me every time they see me, I always get all of the questions about anything pharmacy related.
Yep, that's what happens. But that's
Hey,
a good
I'm taking
thing.
this medication.
Yep.
Yep.
Yeah.
Yep.
Excellent, excellent. All right, so if people are interested in our offerings, they can visit our website at cetrain.isu.edu, or they can email us at cetrain@isu.edu, or give us a call at 208-282-3372. And this podcast is the way that we let people know about, programs like this at the College of Technology and meet wonderful people like LynnDee. If you enjoy this podcast, please like, share, subscribe, the whole thing. And as always, be safe out there.